Hello, everybody. We are the Physical Activity Health Promotion Group, and we have found three different physical activity health promotion campaigns that we analyzed here today. We looked into what behavior health theories we think were used in the development of these campaigns, and then also analyzed how effectively we thought those theories were applied and how effective the campaigns were as a whole in their targeted communities. The first campaign we looked at was the World Health Organization's hashtag Healthy at Home campaign. They developed social media tiles for the COVID-19 lockdown to try and maintain physical activity levels of people while they were trapped inside, couldn't go out, gyms were closed, all those kind of things that we all went through. You can see the two examples of the social media tiles there, and we think they were developed using the theory of reasoned action. They really highlight the good versus bad assessment portion of that theory. They really tried to highlight the high benefits of physical activity and minimize the costs to push the balance towards a net gain for people that were looking at these social media tiles to really encourage physical activity. You can see in those tiles that it says, doing any activity is better than none, and tries to list all the benefits and doesn't really mention any costs or time consumption or anything like that, and really just attempts to make it seem like it's a free benefit and there's no drawbacks or anything like that to physical activity. But we decided that this was an example of a poor campaign. The information is non-specific. It doesn't provide any, time frames for physical activity or routines or anything like that. It's very broad and general, and it really minimizes the cost. Was the one good thing of it. Like I said, it doesn't really mention any drawbacks or negatives towards physical activity. It doesn't address any subjective norms, which is another reason why we think this is a poor application of the theory. The subjective norms are a huge part of the theory of reasoned action in terms of the constructs, and they're not referenced at all really in these social media tiles. And it kind of comes off as a friendly reminder of something you'd see on Twitter or Instagram rather than an impactful campaign that could actually create effective behavior change in the targeted community.
Um, for the next for the next program, it is the Choosing Healthy and Active Lifestyles for Kids campaign, and it's called CHALK. The theory that was applied here was the trans-theoretical model of change, or stages of change model, in which the intervention methods were matched at where the children were. They met them at their level of behavioral efficacy and physical activity levels. The health promotion took place in many different avenues, from faith-based organizations, community organizations, elementary schools, high schools, early childhood centers, and so forth. They disseminated the campaign via billboards, social media posters in stores, and nonprofit organizations, and of course, healthcare settings. Childhood obesity impacts Latino children a lot at a high rate, and that's why they focus this program for them living in poverty. This was the moderately effective campaign. It was moderately effective because it was culturally appropriate. There were a series of intervention methods that was in English and Spanish language, so that the children and their entire family could take place, or they could take part in the programs. As I mentioned before, the programs were stage matched, and it depended on the student's baseline physical activity levels, so they met the student where they were. This was the easiest form of health promotion, just by advertising different ways to be healthy in multiple avenues. It was a more specific approach to physical health, which was a good thing. It wasn't a one size fits all approach, and a potential drawback was that the surveys were given 1 to 2 years after the intervention methods had taken place, so it would be more beneficial to have long term measures, maybe 5 years or so, just to see how effective the campaign was.
Our next health promotion program is called Vic Health, also known as the Victorian Health Program, Physical Activity Promotion. So Vic Health, the theory that we found most applicable to them was the theory of reason action. It lists a combination of risk factors that are lessened by physical activity as well as the benefits received. Upon analysis of the program, we found it to be an excellent program. The website hosts a variety of information. It talks about things like promoting healthy eating, encouraging regular physical activity, preventing tobacco use, preventing harm from alcohol, and improving overall mental well-being. And it also targets people at different age groups, genders, and physical ability statuses. Some key findings that were found were over half of all sport participants are aged 4 to 14 years, and sports participation is highest among children that are aged 10 to 14. And that concludes the slide for our physical activity group. Thank you.
Thanks, everybody.